I'm Dr. Girish. I'm a consultant surgical oncologist at Aster hospitals. I work both at CMI at Hebbala and Aster RV at JP Nagar. I'll be speaking few things about lung cancer. November being Lung Cancer Awareness Month, we probably will want to discuss few things which are required for the general public to be aware about. Is it a common cancer? Yes, lung cancer is a very common cancer including whole of the world population and India. It is one of the leading cause of deaths in India and the whole world also. Is it related to any addictions? Yes, very commonly it is directly correlated with the usage of tobacco either in form of smoke or smokeless form. So awareness to stop tobacco usage is very important so that lung cancer, which is directly correlated with tobacco usage, is reduced. What are the symptoms? Symptoms usually are chronic cough. Patient who's been smoking has suddenly develops cough which has been there for a long time, though not associated with fever. There may be weight loss. Very frequently it is associated with hemoptysis. Hemoptysis means coughing out some blood whenever he spits, either in the early morning, wherever he has a bouts of cough, he usually spits out blood. So these things are common things. These are usually very similar to the symptoms where a patient who has no cancer but who has developed some pneumonia or because of any other infective reasons can also present with such similar complaints. Though hemoptysis may not be, that is the coughing out blood may not be so common, but chronic cough is a very common symptom associated with smokers or any other infections who may not be harboring cancer. Here lies the importance of early detection. A visit to a proper physician who can differentiate either by clinical examination or by appropriate investigation is very important so that it can be picked up in an early stage. Picking up this lung cancer at early stage is very important because the presentation itself is usually at a later stage where the curative intent of treatment is not possible. That happens as a very common scenario in lung cancer. So picking it up at an early stage is very important. So visiting an appropriate physician who can tackle such things is much importance. So simple investigations like X-ray or probably if required a bronchoscopy can probably help us in detection. Further, a CT scan definitely will add up to the diagnosis. Is it totally related to tobacco? No. Much of the scenario in the present epidemiology is been changing so that no usage of tobacco is also seen with much of the patients who are having lung cancer. Presentation in such people is usually younger people. The tobacco usage and the smoking people or the non-smokers usually have at a later age group, at an older age group. But these people in the present last around 4 to 5 decades, the rise of adenocarcinoma, which is not associated with smoking, is commonly seen. So any symptoms of chronic cough, hemoptysis would not be neglected and has to be evaluated by a physician. What is the treatment? Treatment probably, as I mentioned, it depends upon the stage which has been diagnosed, the presentation at which the patient has been presented to the appropriate physician. So surgery as a curative treatment is the most important thing which is offered to an early stage patient. As in the same slightly advanced status, probably a combination of radiation and chemo will also be as a curative treatment is offered to the patient. But much of the people in lung cancer present at a later stage which are metastatic. Metastatic in the sense they would have spread to other organs, commonly to bone, brain and adrenal glands. In such scenarios, probably the present advanced treatment of target therapy and immunotherapy has played a major role where the medical oncologist can offer you a good quality of life and probably a increased longevity also, which would not be possible probably in the last 5 years, before 5 years. So a visit to an appropriate physician and diagnosis is most important, and definitely stoppage of usage of tobacco either in the smoke form and the non-smoke form is very important. Awareness about cough, chronic cough, hemoptysis, weight loss, not feeling hungry, all these things are important so that the patient presents to the physician at the earliest. Thank you.